Public Health Communications Officer for the County of Santa Clara Public Health Department. Today we have an update for you about novel coronavirus in Santa Clara County. First, I'm going to introduce our speaker, and then afterward we will have time for questions. So today, Dr. Sarah Cody, who is our County Health Officer and Director of the County of Santa Clara Public Health Department, will provide a brief introduction. So thank you. Sarah.
Good afternoon, and thank you for coming today. I'm Sarah Cody, the Health Officer for Santa Clara County. Earlier today, the CDC notified us that a resident of our county is confirmed to have the novel coronavirus. As you know, this is the first case in Santa Clara County and in the Bay Area. Since we are a large county and many of our residents travel frequently for business and personal reasons, we're not surprised to be announcing the first case in the Bay Area and in Northern California. Actually, we've been preparing for this possibility for weeks, knowing that we were likely to eventually confirm a case. Preventing and controlling the spread of infectious diseases is what local public health departments are built to do. It's one of our core functions, and we are in full swing. Although we are announcing a confirmed case today, please know that we do not have evidence to suggest that the novel coronavirus is circulating in the Bay Area, in Santa Clara County, or really in Northern California. The case is an adult male who lives in our county. He had traveled to Wuhan, China, and became ill upon returning home. Since his return home to the county, he has been self-isolating at home and did not leave home at all, except to seek medical care. He was seen in a local clinic and hospital, but was never sick enough to be hospitalized. We are currently reaching out to anyone he may have come into contact with to assess whether they may have been exposed to the novel coronavirus. Our preliminary investigation indicates that he came into contact with very few individuals after returning home. We are making sure that anyone that he did come into contact with is being monitored for symptoms and staying at home away from others. We are working closely with our healthcare partners, the state and the CDC during this investigation. They are advising us and have offered staff resources. We are also working closely with our colleagues in the county and in the Bay Area. And I have to say that the support from our healthcare and public health colleagues has been tremendous, and we thank them. So what does this mean for the general public? Although we do understand that this confirmed case may raise concern, this one case in fact does not change the risk to the general public. Our assessment is that the public at large is still at low risk because this case was careful to self-isolate at home for the entire time since he returned from China. Thank you.
Before we take questions, I do want to let our Spanish TV stations know that we will have time following the press conference to do one-on-one interviews with Dr. Sarah Cody. So now we will take questions. We have both Dr. George Hahn, our Deputy Health Officer, and Sarah Cody, the County Health Officer, to answer questions. Yes.
How long was he in Wuhan before he started developing symptoms, and did he have to come in contact with many people? Was it anyone outside of the immediate family, co-workers?
What we know is that the case returned on January 24th. Since his return, he has only been at home. Very few contacts in his home, and he has been there the entire time since his return, the only exception being travel to seek care.
He returned from China on January 24th?
He did not return directly from Wuhan.
When did he return?
So I don't have the exact details of where he was when prior to his arrival back here. He did return. He had been in Wuhan, he had been in Shanghai, and then he came back to the county on January 24th.
How long was
So, as part of our public health practice and our public health investigation, we identify all contacts, all close contacts, and those contacts then isolate at home for 14 days. So the question is about what steps are we taking with regard to human transmission. So we're doing the following. This is really part of a public health contact investigation. So our team is working diligently right now with help from the state and the CDC to stand up a full contact investigation, very meticulous, understand who his contacts were, and then follow up with each and every one of them. We're actually quite lucky in this case in that I think the contact list is going to be rather short. There are household members, few. I'm not going to give details on exactly how many, but what I can say is that, again, we are quite fortunate in this case, and that I think the list of contacts, since he's returned here to the county, is going to be very short. I mean short. Yeah. Can you handle the question?
Yeah, excuse me. Next.
He an adult male.
What's the case here? So he got the symptoms, he just stayed home. What's going to happen from then on? He goes to get care?
Since the patient returned back to the county, he has been self-isolating at home for the entire time. He has not gone out except to seek medical care. He has not been very ill, so he's not been ill enough to require hospitalization. He's just been in for outpatient care. So he's currently being isolated at home, and we will be following him closely at home until he's no longer infectious.
Next
So
question.
what's the sort of evidence that you need to see to make the determination that the virus was indeed circulating in the community?
Right. So one question is, what do I mean by circulating? And that is, I mean that, for example, influenza virus is circulating in the county now. We know that it spreads person to person, and we see cases in outpatient clinics and in hospitals, and we have deaths every year from influenza. That virus is circulating. The novel coronavirus, to date, we've identified in one individual in our county that was confirmed this morning. So that means that if you've not identified it in more than one person, it's not circulating.
So what about the happening would follow a similar trajectory as flu?
So we are, I think that since the WHO declared a global health emergency, we're all looking very carefully. Our focus is on identifying cases because we want to understand, is it spreading? How is it spreading? But I want to emphasize, to date, we have one confirmed case. It's the third case in California, despite very active surveillance, looking and testing.
Excuse me.
Do you have someone else with a question?
He had a question.
Did he travel alone and when
I don't have any information about his travel companions, and I can't give the city. I can just tell you that he resides in the county.
If he wanted to require any kind of hospitalization, where would he go?
I don't think I can answer that question. We're not going to be giving out information about where he sought health care.
Go ahead.
Can you give someone else a chance to answer?
Feel like they're doing something to stay protected.
My general message and what we have been emphasizing, and I want to continue to emphasize, is that right now we're at the peak of the flu season. Flu is circulating widely. Hospitals are seeing a lot of influenza. There's a lot of illnesses from other respiratory viruses. And so that actually, it's far more likely for people to become ill from the flu. So general messages that are really, really, really important. If you're sick, stay home, stay away from others. Second, if you're sick and you're with somebody else and you cough or sneeze, do it in your sleeve. Use tissues. Wash your hands carefully. If you're not sick and you don't wish to be sick from other people, it's also really important to wash your hands frequently and to avoid touching your eyes, nose, or mouth. And finally, it's really important to get your flu shot. It's still available. There's still flu circulating. And so if anyone has not had their flu shot, we really encourage that.
Next question?
Doctor, when you said the 24th, is that the day that you landed back here?
Yes, he landed on January 24th. He landed on the 24th and went directly home and has been there since.
Next question over here, please. Sorry, next question over here.
Talk about the relative length of this virus versus until 10,000 a year, or 170 plus, which is worse, which one is
So certainly now in the United States, we have very, very little coronavirus, of this novel coronavirus documented. So I think our case would make the 7th case in the entire country. We know that we have, 36,000 deaths from influenza in the United States every year. So the impact of the novel coronavirus is significantly dwarfed by the impact of influenza. I think that what distinguishes the novel influenza is that it's novel, it's new, there's a lot that we don't know. And so I want to acknowledge that people feel rightly concerned because it's new. But as far as the amount of actual disease and infection that it's causing, it's very, very small in the United States at this point.
Next question over here. I'm sorry, who's next?
Did he wasn't hospitalized or did he go to any other care facility?
So the patient returned to the county on January 24th. He remained isolated at home since he came. The only exceptions are he left home to seek medical care 2 times. Both times it was outpatient care. We're not releasing the details of where he sought care. What we are doing as part of our contact investigations, we actually have several different types of contact investigations, and I'll describe them briefly so that the public can know. One is to understand all the different places that he was and who he was in contact with. As I mentioned, he self-isolated at home, so that's really his household. Second, we refer all details around flights to the Centers for Disease Control, and they follow up in the event that he might have been infectious while on an airplane. Third, we work very closely with our healthcare partners in the healthcare facilities to identify anyone who might have been exposed while this person was seeking care. That's part of our contact investigation. Part of our contact investigation is to work very closely with the healthcare partners, identify just where the patient was and who may have been exposed, and then take the appropriate follow-up. Anyone who may have been exposed, who's identified during the contact investigation, would be contacted by one of the investigation team members.
We have a question over here.
To be clear, he contracted the virus there and came back, but he was sick while he was traveling and arrived on the 24th and realized he was sick or had the virus, or he came back, didn't feel well, went out to get checked, and that's when they found out he had the virus.
He was exposed to the virus while traveling in China, most likely in Wuhan. After he arrived back here, he became ill and sought care.
Do you know which airport he came into?
The patient arrived through San Jose International Airport.
All right, next question is over here. Okay, you wanna, okay.
To be honest, I don't have those details. Understand that we just got this information this morning, and there's a lot of details that we're still gathering.
How many tests are you running? How many contact tests?
I'm not, can you?
So you're doing a contact investigation, right? So you have people that you're testing, that you may have come in contact with, just can you say how long that is?
I can tell you a little bit about our process for a contact investigation. So we identify the various groups of people who might have been in contact and might have been exposed. Those would include household contacts, healthcare contacts, airline contacts. Our federal partners for the Centers for Disease Control and Prevention, as well as our state partners from the California Department of Public Health, will be assisting us in those investigations. We're just launching them, so we don't have detailed information about how many people in each group.
We'll take one more question. David Louie, you've only asked one question here.
What I will say is that we're a large county of 2 million people. We have a lot of travel in and out of the county. So at any time, we always have a lot of reports that we're following up on for novel coronavirus, for measles, for meningococcus, for salmonella, for E. coli, for TB, for syphilis, et cetera, et cetera, et cetera. We never announce and report on cases that we have that we're investigating until we confirm them. Same is true for novel coronavirus.
Okay.
This man is staying at home. There's going to be a point where, you know, he has to go out for food, or somebody's going to have contact with him because of food or emergency, or like what's going to happen then? You know, they're going to, even though you're saying I'm quarantined, right?
One of the things we do in public health is when we have to isolate someone because they have an infectious disease, this person has been strictly isolating himself at home ever since he returned from his overseas travel. Isolate means you don't leave your home. So if a family member can support the person, then the family member does. And if not, we mobilize public health resources and support the person at home.
Okay, this is our last question right here.
Is there anything that your office is doing now that there is a case, or anything that's changed on your end?
We're responding to a lot of media calls.
Okay.
We're very busy. Yeah, we really appreciate you all coming out and covering the story. We appreciate your support, and I want to tell you that we have had not just support from you all, but phenomenal response from the Centers for Disease Control, the California Department of Public Health, and our colleagues in the Bay Area. I mean, it's very heartwarming when we ask for help. Help is here. So thank you, thank you, thank you.